This video is continuation of class on Temporo Mandibular joint. So we have already studied the type of joint. It is synovial joint of condylar variety. Then we studied about articular surface, upper articular surface and lower articular surface. Upper is by articular tubercle, mandibular fossa, and inferior articular surface is from the height of mandible. So we studied about 5 important ligaments of TMJ: fibrous capsule, lateral temporomandibular ligament, sphenomandibular ligament, stylomandibular ligament, and pterygomandibular ligament. One important disc comes called an articular disc, which is the specialty of TMJ. Then we studied about blood supply, nerve supply. Now we'll be talking about the movement that is possible in TMJ. So what is the movement that is possible? Number one, there are 5 movements that can occur. Number one, depression of mandible. Depression of mandible. That is, whenever you open the mouth, mandible or the TMJ, depression. This action movement is called depression of mandible. Open the mouth. The primary muscle responsible for this is lateral pterygoid muscle. Second movement is elevation. That is when you close your mouth. Principal or the major muscle involved in masseter, medial pterygoid, temporalis. So if we carefully observe these 2 movements, so we have 4 muscles of mastication except the lateral pterygoid. All other movements help in elevation of mandible or closing the mouth. Next other movement that is possible is protrusion. You can see the arrow in purple color. So this moves the whole mandible anterior. Principal muscle here in protrusion is lateral pterygoid, assisted by medial pterygoid. Next is retraction of mandible. So we see green arrow, the whole mandible moves posteriorly. It is mainly brought about by posterior fibers of temporalis, deep part of masseter, geniohyoid and digastric muscle. So this is how protraction and retraction. The last movement is side to side movement. That is when you are chewing gum, when you are chewing or swallowing or chewing food that you eat. That movement is also possible in temporomandibular joint. Chewing from left side produced by right lateral pterygoid, right medial pterygoid, which push the chin to the left side. That is how the movement that occurs. Other important aspect of TMJ is relations of temporomandibular joint. So roughly this is the schematic representation of the relations of temporomandibular joint. If you imagine TMJ as a cube, there is a superior surface, anterior surface, posterior surface, inferior surface. This is the lateral surface. So see, superiorly it is related with the middle cranial fossa. TMJ, what is that? Middle cranial fossa. Along with that, you get the middle meningeal blood vessels. This is the middle meningeal artery and middle meningeal vein. Inferiorly, you will be getting the maxillary artery. Inferior to TMJ, you are getting maxillary artery. Next we will see lateral relations. You got the skin, you can see the skin, the carotid gland, the temporal branches of facial nerve. So this is facial lateral relations of the gland. We see medial relations. So in the next coming diagrams, I will be telling about posterior relation. Carotid gland separates the joint from the external acoustic meatus. Then anterior relations will be getting lateral pterygoid muscles, mesenteric nerves, and arteries. So these are the anterior relations. Posteriorly relating superficial temporal blood vessels, auriculotemporal nerve. These are the posterior relations. So now we have studied about lateral relation, anterior, posterior, superior, and inferior. So the next diagram will show you what are the structures that are related to medially to the TMJ. You can see that this TMJ, this joint cavity is TMJ. You can also see the articular disc here. So the whole thing is covered by synovial fluid. This is the capsular ligament. Medially it is related to tympanic plate, separate the joint from internal carotid artery. Tympanic plate. Next, spine of, you can see spine of sphenoid, spinomandibular ligament, auriculotemporal nerve, middle meningeal artery. These are the medial relations of temporomandibular joint. Next important ligament that we should always they ask in the exam is this ligament, that is spinomandibular ligament. It comes as a 5 marks question for you. So to ask this, you need to tell about attachment. So this is spinomandibular ligament. It is one of the accessory ligaments, extends from spine of sphenoid, to lingula of mandibular foramen. It is a remnant of the dorsal part of Meckel's cartilage. So remember this, remnant of dorsal part of Meckel's cartilage. Now we'll go to the relations. Lateral, it is related to lateral pterygoid muscle, auriculotemporal nerve, and also the maxillary artery. The ligament is medially related with chorda tympani nerve. Can you see here? Chorda tympani. Now, the wall of pharynx. Near its lower end, it is pierced by mylohyoid nerve cylinders. You can see clearly here. The lower end, it is pierced by mylohyoid nerve cylinders. So, these are the things you have to write as spinomandibular ligament in short question. Then we also read about this diagram. Two important nerves. Medially chorda tympani, laterally auriculotemporal nerve. Two structures that are pierced are mylohyoid nerve cylinders. They can even ask you multiple choice questions. Then you should remember the importance of attachment. Spine of sphenoid on one side, lingula of mandibular foramen on the other side. Then you should also know about the remnant. It is the remnant of dorsal part of Meckel's cartilage. So this finishes TMJ relations and also spinomandibular ligament. Temporomandibular joint is the main question for you. Spinomandibular ligament can be asked as a short notes. Next we come to applied anatomy. Most important is dislocation of mandible. It occurs during excessive opening of mouth or during yawning. What happens? The head of mandible of both or one side may slip anteriorly into the infratemporal fossa, which causes inability to close the mouth. So this is dislocation of mandible. Now how will you reduce this? Is one by depressing the jaw with the thumb placed on last molar teeth and at the same time elevating the chin. So this is how we can reduce the dislocated mandible. So this is all about temporomandibular joint. Very important in respect to examination point of view. How will you go through it? Remember type of joint. Remember articulating surface, superior and inferior articulating surfaces of TMJs. Ligaments involved. There are 5 ligaments that are involved in TMJ. Fibrous capsule, spinomandibular ligament, stylomandibular ligament, and lateral temporomandibular ligament, pterygomandibular ligament. So this is then you should know about the articularities. Next, we studied about relations of TMJ, blood supply, nerve supply, and movements that occur in the TMJ and the muscles that produce movement. The last thing is applied anatomy, that is dislocation of mandible. So this finishes temporomandibular joint. Thank you.